I'm going to tell you the 3 things that I look for in patients that if they're like, hey, I think I have a disc herniation, prove me wrong. And so the first thing is that you're younger, right? So most likely disc herniations are happening in people who are younger, 30s, 40s, 20s, and there's usually an incident associated with it. And so if we look at the occurrences of disc herniations, the younger you are, the more likely you are to have it. L4, L5, L5S1 are the most common areas. And if you're younger, you're more likely to have a disc herniation. The other symptom that I'm looking for is radicular pain. And so remember the stages we went through, and the disc material starts to push on that nerve root. And if you're having symptoms that are more like sharp, stabbing, burning discomfort into the leg, calf, or foot, like, yeah, if you're younger and you're having that, I'm really leaning towards a disc herniation. And so those 2 things themselves, I'm like, ooh, I'm really starting to think disc herniation. But then the last caveat related to that is the image. And so a disc herniation itself can be symptom-free. So we cannot rely on just symptoms for disc herniation. A true disc herniation can only be diagnosed from an image, and that image is typically an MRI. And what you see on the MRI is that you see that disc material starts pushing towards the spinal nerve root, just like I spoke to earlier. That is going to be classified as a disc herniation. And so sometimes with a disc herniation you will have sciatica, sometimes you will not, and sometimes, you know, sciatica can be completely independent. But I want to go over the things that I look for in my patients. I'm like, oh, you don't have a disc herniation, you have sciatica.